Yeah, welcome back to ThinkTech. I'm Jay Fidell. It's the 1 o'clock block on a Thursday here at Global Connections with Carlos Juarez, who joins us from Austin, Texas. And we are going to talk about the pandemic internationally. So often, Americans, including a lot of members of Congress, they see things. They look down. They don't look over across. They don't have international vision at all. And come, here to tell you that some of them don't even have passports. My goodness, they look at their shoelaces and they don't build an international view of the world into their thinking. We try to do that, and certainly Carlos tries to do that. Carlos, welcome back to your show. I'm very interested in your thoughts about looking beyond our shores to see and examine, be concerned about the pandemic.
Yes, well, great to reconnect as always, Jay, and thank you. Indeed, I mean, we have to be reminded that this is a global pandemic, right? And it continues to be. And while we can see some signs of good progress in the U.S. and some other places, we also see some challenges that continue, and particularly in parts of the different world, the developing world especially. There are still places that are under the radar that have very long ways to go before they even approach a vaccine program. And also, I want to talk a little bit about there's an initiative, a global initiative known as kovacs. And this was set up right at the outset of the pandemic as an initiative basically to make sure that everybody in the world gets access to vaccines. In other words, the poorest, regardless of the ability to pay. So, in principle, the idea is there. In the fall, back when it was established last fall, 2020, the kovacs had a very clear goal, very specific. They wanted to buy 2 billion doses and make them available to all the nations in need before the end of this year. Now, 5 months into this year, COVAX has delivered 68 million doses. Let me repeat that. Out of 2 billion, they've delivered 68 million. I'm sorry, yeah, 68 million. So in other words, 3.4% of the goal. So clearly not enough is being done. So, there was this meeting, this discussion at the outset. The result is that, yeah, there are places that right now, I mean, they're looking into the future and have no clue when they may get there. Uh, Let me add, though, that things are in flux. And then we had an interesting dynamic here just even in the last days. The Biden administration has announced a plan. I haven't looked at the details yet because some of it's still coming out, but essentially willing to make available now some of the stock that the U.S. has. Now, let me make clear that from the other world, at the outside world, especially the developing world, many see this vaccination issue as another example where the rich, powerful countries have basically hoarded everything, bought everything, and the poor, developing, other world, the South, is left for the crumbs to wait and see what happens. Now, that's a reality for some places, of course. Now, of
There's
course,
an irony too, though, Carlos.
yes,
If
yes,
you look overseas, we should make this distinction. If you look overseas, you're going to find that most countries, especially the ones hardest hit, people want the vaccine. They do not have, quote, end quote, hesitancy. In the
yes.
US, some 40%, some enormous percentage of people in this country are hesitant about the vaccine, which is really very ironic. We have it, they don't want to take it. Overseas, they don't have it, and they do want to take it.
Yeah. Well, again, and let me just say that the nightmare scenario has now become a reality because around 1.5 billion doses have been administered around the world, 1.5 billion, and yet only 0.3%, less than 1%, 0.3% has gone to low income countries. So literally
Mm.
nothing. And you can be assured some of those elites and the wealthy have made their way to the first world and gotten their vaccinations. There have even been a lot of scandals. Peru was one example, El Salvador another, where the governing elite, the ministers, and they sort of got their families vaccinated, dosage that were intended for obviously let's say others. The bottom line, though, is that we've got places like India and Brazil, these two large populations, where thousands of unvaccinated people are dying every day of COVID-19, even as Americans today are reveling in our vaccination status. We're doing okay, we're taking off the mask, everything is good. But we have to remember that no, the world still has this. And why does it matter? Well, as long as these variations persist and transform, and we have continuation of it, the mobility of people, of container ships or whatever it is, the virus is going to continue. And yes, those that are protected and vaccinated will be less vulnerable. but it doesn't, it'll still affect others. And bottom line, this is one of those global issues that, at the end of the day, we have to figure out collectively. We have to solve as a global problem, and the wealthy countries like the U.S. have got to step up a serious commitment to helping roll out the vaccination in other places, making it available, basically. Um, yeah.
The Spanish flu in 1918 happened in this country. And in the war, First World War, our troops went to Europe and they brought the Spanish flu to Europe. It was called the Spanish flu because everybody figured it started in Spain, but that wasn't true. It just revealed itself in Spain, but it was all over Europe. A lot of people died. Now, in this country, it had run its course in the year that followed its original infection, and it was on the decline. However, the boys in Europe came back, and they brought the Spanish flu back for another epidemic in this country. And I don't know if it was a variant or what, but the second epidemic was worse than the first epidemic in this country. The point I make with all of that is to say that you cannot assume that if the U.S. Beats the curve, and reduces the number of infections, that's the end of it. Because, as you say, ultimately people will be traveling, and they'll be going to other countries. They'll either be bringing our brand there or their brand here, and it will be global, whether we like it or not. Ultimately, it will come back. So we have every interest in making sure that that medical supplies and vaccines and the like are available in these developing and developed countries overseas, because they are our brothers in this matter.
And listen, I mean, some of these countries, particularly India, is a real good example. Brazil included, though, they are major producers of vaccinations. They have been for some years, and they have the facilities. But today, the crisis that's in India, which is flared up here in the last month, the crisis is so bad that it's beginning to impact the COVID vaccine, this kovacs program that I've mentioned, due to a shortage of doses that come from this one specific institute in India, the Serum Institute. This is the world's largest vaccine provider, and they've had a soaring demand given, for the shots, given the situation and the flare up in India. The result is that they were supposed to deliver 140 million doses to this COVAX for the poorest countries, and they're not going to be able to meet that at all. Indeed, it looks like, again, over and over these past few months, a lot of the promises that were made, and in a country like Mexico, where I've been as well connected, they were assured and told that they were going to get X amount. They didn't get it, and so the shortages are falling, in every place, and the result is, again, very low levels of vaccination throughout. Another case in point, let me mention, for example, the country of Argentina. They have been caught off guard in a dramatic way because overall the situation there was relatively mild. It wasn't as bad, but they've gone in the second wave now, from having relaxed their restrictions and a relatively low rates of vaccination. They had, for example, daily rates of 5,000 cases in early March. This week they have 35,000, just like 7 times as much. And the deaths, they began at 112 a day. Today, they're recording 744 just a few days ago. So my point is that a lot of places, and it's not unique there, we even have like Taiwan and Singapore that have been role models. Today, we're seeing flare-ups there in ways that, again, we knew this from the start. You're going to have these spikes, and it requires a very concerted effort from the public health authorities, obviously, to inform and mitigate, contain, and do the whole tracing, because otherwise, you continue seeing this.
It's very discouraging. A friend of mine was supposed to travel to Singapore. Singapore was closed for a long time, but because they have, what do you want to call it? The kind of institutions that can act on a dime.
Yes.
And they closed it down, and he couldn't go to Singapore, and then they opened it up. But lo and behold, just a few days ago, they had a spike in cases and closed it down effective tomorrow. So I think what we see is governments are maybe more responsive these days to the spikes in cases, and that's good. But there are spikes in cases. The other thing I wanted to mention, you talked about India. Like 3 or 4 months ago, we had a talk show with one of our correspondents she sort of represents India in the EU, and so we talked to her in Brussels.
Yeah, yeah.
And she told us that India had the ability, maybe it's the kovacs program, to generate a lot of vaccine, and they have a medical establishment in the country that can do that, and they felt as an altruistic thing that they were going to give and sell the vaccine in large quantities to other countries who fared less well. And that was the plan last fall in India. But
Yeah.
wow, just as you say, all of a sudden that plan has been frustrated by their own
Yeah.
increase and surge and what have you. And now they can't do it. They got to handle their own people. So it's kind of, this goes to the point of the show. I think is at the end of the day when you have a serious threat to your country, to your population, you're going to deal with them first, aren't you? And although we think, that the world would be a better place if we all, disregarded borders and came together as one, but when you're facing an existential threat, you can't really do that.
Yeah.
And so I think we're learning a lot about humanity and about
Yeah.
borders and about the international order, aren't we?
We are, and let me add this. Some years ago, I began using a book for some of my teaching about international relations theory, and it's a great little booklet by a Princeton professor who writes about zombies and how you can see zombie movies, and how it shows the response. And I say that because the pandemic has brought out a lot of this. The realism, the school of thought, where you look out for your own interests. There's a very almost a paranoid, pessimistic view of the world, and huddling around. And we see that today. Vaccine nationalism is very much alive. You also have, and going back to Singapore that you just described, this is an example where it becomes an opportunity to scapegoat and to discriminate against certain groups, because the story in Singapore is a little bit different from other places. And even though they had very stringent measures in place, low cases, public gatherings were kept to a minimum there was still some gaps. And for example, the airport in Singapore, the Changi airport, it's a very popular shopping center as well. It turned out to be one of the biggest COVID clusters this year. And the authorities later found out that a number of the infected airport staff, they had been working in a zone that received travelers from some high-risk countries in South Asia, from India, from Nepal, from Sri Lanka. And there are workers that come there. The point is that suddenly they become stigmatized. They're the ones who are identified as the source of it. And some of these workers went on to have their meals in the airport food courts, which are open to the public. And that's where a further spreading of the virus occurred. So now they've had to close down all the passenger terminals to the public as a result. And just again and again, we see examples of, where as much as you may try your best efforts, there's just always going to be this, somehow somebody brought it in, and guess what? It spreads. It's interesting how we're learning along the way. And again, places that, Singapore, you would not have thought about having any issues. Well, boom, they suddenly had to close their airport and do some dramatic policy changes.
Well, the disparity is really troubling, where some countries get it and some, disadvantaged groups don't get it. And the trouble there, I think, is that we have not advanced our international health systems far enough, long enough.
No.
I mean, you can say the World Health Organization is a information gathering and an exchange place, a place for cooperation among health officials from various countries, and they publish, articles that are written and so forth. But they could have been much more active here. They could have found a way to, obtain the vaccines and distribute the vaccines. What is it, from each according to his ability, to each according to his need.
Yeah.
Or free. They could have done it free. It's a pandemic, and if you buy the notion that a pandemic affects everyone everywhere, then you find a way to make it free instead of have this what did you call it, the vaccine nationalism.
Yeah.
There's this disparity, and I the problem with pandemics as they existed in the early 20th century, the Spanish flu, is that the people who suffered and died are not around to testify, to tell you, to
Yeah.
campaign for a better solution. They're gone, and everyone else would like to just forget what happened. They don't want to know. So, you know, ideally, at the end of a pandemic, you would expect there to be significant changes in public health, significant and global. Since it is a global experience, there's significant global changes in public health. We didn't get that in the Spanish flu, and everybody forgot about it as quick as they could. And now I fear that we're going to have the same experience here,
Yeah.
except that I think we're forgetting too early.
Yeah, and I think the challenge comes because you have, let's say, in what is the public health agencies, ministries, departments in every place, you have a professional staff, typically, epidemiologists, medical scientists, and so on, and they operate under the certain set of values and all. But what I want to say is that the political leaders, they are driven by different incentives. It's not the science. It's political survival. It's reelection. And all too often, okay, everybody knows, well, we got to do something. We got to step back, do some, and those who are, let's say, accustomed to this will know that this is the time to debrief, step back. What can we do? What can we change to make it better next time? But the political leaders have more incentive just to move on, and they're not gonna invest what needs to be done. The results are not going to be there for them in terms of political survival. So there's a mismatch. Yes, this is the time, the opportunity. Let's do it. Unfortunately, it's tough.
The other thing is that the drug companies, I'm not sure which one I'm talking about, but maybe a number of them, who developed these vaccines did it in substantial part with United States federal money.
Sure.
Okay, they
Yes.
did their
Yes.
research, their testing, it's a very expensive business, but they took patents out, and of course, and now they're selling these drugs, these vaccines at a substantial profit. Where the administration, U.S. administration, went to them and said, "How about you waiving your patent rights? Because after all, we granted you enough money to create this vaccine in short order. So how about putting it in the public domain, and so it can be used around the world?" Oh, and they resisted. I don't know how it all came out. I think it's still in play, but it shows you they want to make a profit, even though the research was funded by the federal government, and it's hard to be sympathetic with them on that.
Yeah. No, and it shows you that, okay, their different interests have different, or let's see, different stakeholders. Let me put it that way. They have different interests based on what's in it for them, and so on. At the end of the day, though, we have a world, again, the inequality is abundant. The wealthy countries have basically gobbled up and absorbed everything. And at the end of the day, they're going to need to share. We need to, the wealthy countries essentially to share it. And this can mean sharing doses that have already been delivered. For example, in the United States, we currently have about 73 million doses that are sitting in a stockpile. 73 million. And ideally, those could be donated even before they even arrive here. But the fact is, that becomes a challenge too. Transferring the doses after they've been delivered, it's got other tricky problems there. But the bottom line is that, the U.S. on one hand can afford to do this. A recent study here by Duke University showed that we're likely to have at least 300 million excess doses based on what we have already let's say committed to buy at least 300 million excess, and that assumes the U.S. is going to retain enough doses to vaccinate the majority of children. We're already seeing that beginning a process there. In other words, every eligible or soon to be eligible American could get vaccinated, and there would still be 300 million doses left over, practically enough to give an extra dose to everyone in the country. And in this surplus, I mean, it's so staggering that not sharing it makes it look morally unjustifiable. I mean, how can we justify it when you've got, again, the rates of vaccination in so many of these poor developing countries is they haven't even started. It's less than 3% of this kovacs commitment has come through, and so yeah, it becomes an issue. But I would say this, the countries, we shouldn't only focus on donating excess doses. That's one thing. If we wait until, everybody is eligible, I mean, it's just going to delay a lot of this. So right now, you have an interesting case of Sweden up in Northern Europe. They have recently decided to donate 1 million of their doses, 1/5 of their current supply, even though they only have 30% of the population that's received a shot. Again, that's this altruistic sort of different approach that's coming from there.
You got to give
But
them credit for that.
yeah,
That
yeah,
was the same intention that was held in India a few months
yes,
ago.
exactly. Yeah, no, no, it's quite astonishing. So again, I think for us, it's easy to get complacent, and we're seeing some progress. Things are looking better. More and more people that you talk to, oh yeah, I got my vaccine. But we've got to stop and realize, guess what? The show, or not the show, but basically the pandemic is not over, not going to be over anytime soon. And it's going to require, even as you travel and people are going to start loosening up and going, well, guess what? You're going to places where you may be a spreader yourself. Even if you're vaccinated and you survive it, you may be a culprit for continuing to move this virus around.
Yeah, even if you've had the vaccine, it doesn't rule out the possibility you can catch it again,
Yeah, yeah,
either in a mild form and then be a spreader when you come home,
yeah,
or in a more dramatic form, where you get sick.
yeah.
Not necessarily because you have the same virus as the vaccine was directed to, but because you have a variant. So travel is going to be risky.
Yeah.
You're a big traveler. I bet you cut your travel down a lot.
Oh gosh, dramatically, of course. And I was able to travel a little bit in the early part of the pandemic where literally the planes were empty, the middle seats were empty. Those days are gone. That was like the first month or two. That honeymoon is over. And now you literally find yourself pretty cramped. And some people are a little bit more conscientious than others about it. And the other difficulty is, different countries, different states have different requirements for whether you've got to arrive with a test. The Hawaii has got its rules, and similarly, we're seeing some relaxation in some places, but others where it's still not entirely possible. Just move
Yeah, and
around
it
freely.
changes all the time too. I
Yeah,
mean, even if you know it one day, you
yeah.
can't be sure it'll be valid the next day. So if I made you the director of health for the world, Carlos, and I put you in charge of some international organization, maybe with the UN, maybe something related to the World Health Organization, then I gave you the resources to acquire some of these stockpiles, and have, I don't know, hundreds of millions of doses at the ready. But they were third world countries, where A, they had no money, and B, they had huge numbers of people who were infected or exposed in some way. How would you allocate the doses you had been able to acquire among those countries? Because now you'd have the power to acquire a lot of it and to allocate it in the way that you saw fit. And the problem comes when you have more people who want it than the doses you have to give them. What do you do?
Well, again, I can imagine it. I envision it like if you're playing 4 or 5 chess games at the same time, different levels. And what I mean by that is that the logistics are one thing, then the prioritizing, obviously, where you're going to have the biggest bang for your buck, the most effective need. Do you vaccinate more people right away, or do And then for the developing world, what they really need are these newer vaccinations that can be the one shot, or that can be the type that don't require the more challenging refrigeration. But look, at the end of the day, it requires a lot of things going on at the same time. It requires what's not happening right now, the clear commitment of the wealthy countries to cough it up. But let's assume in your world that somehow it's happening and now you have it. The other challenge is that in so much of the developing world is, you say third world, it's basically the South, the poor. Many percentage of the population work in the informal sector, and so they don't often have the luxury or the process of even how do you take time off to do that. Um, but look, there's no simple answer there, Jay. I think this kovacs is set up as an example, but the fact that it hasn't been able to deliver yet shows you that despite the best efforts, best intentions, hey, the rich are going to contribute. At the end of the day, there are bottlenecks. The promises made aren't being fulfilled. It's not just about the money, but that's a good part of it. It's all these other issues. And I mentioned earlier this Serum Institute in India. This was, everybody depending on that as one of the major producers. Now India has flared up, and that's had a sudden effect on the capacity to produce the vaccines for the world. Yeah, so it remains again a challenging issue. Many stakeholders, and we have to appreciate that. Some driven by profit and greed, some driven by their own sort of national interest to look out for their own citizens first and foremost, and then others, maybe the doctors and medicals that they want to prioritize how do we contain the virus, the disease itself. Now, different
Do you
folks.
agree with me, though, this should be internationalized? And if
It
the
does,
whole world
yes.
is at risk, then you have to have an organization that deals with the whole world.
It effectively requires global governance. In other words, the very poorest places, they neither have the money, the infrastructure, the capacity, and yet they have the capacity to keep this virus alive. And so we have a vested interest, we have a need to make sure that over time all these places get it taken care of. You just there's no alternative. But having said that, obviously different places are going to have different systems for how they manage the public health. If it's in Africa, if it's in Latin America, and we have this idea that just because countries might be poor, underdeveloped, they don't. Even places in India, they have a pretty sophisticated healthcare system, even very low cost. In terms of information, in terms of expertise, and and yet even today, look at they are overwhelmed. I mean, overwhelmed in terms of the last few weeks, the spikes that we've seen there. Whatever system you have, it only has so much it can do.
Yeah, I think we've become complacent. I think the CDC advice, what is it, almost 2 weeks ago, just about two
Yeah,
weeks ago,
take off the
to
mask.
take off the mask. I think it was a big mistake. I don't know why
Yeah,
they did that.
yeah.
And I think we're going to pay a price. And I think other countries, are following suit on that sort of thing and also being complacent. Mistake. Bottom line is, when this first started and the authorities and the academicians first began calling it a pandemic, that carries with it the notion that a lot of people will be sick in a lot of places in every corner of the world. We didn't believe it at the time. We didn't really believe it. And furthermore, that a lot of people would die. And then when you add what we have learned talking to the same people over the past year, namely that, so this is one pandemic, but the incursion of humankind on the natural world, and the fragility of the natural world and the animal world, make it clear that we'll have pandemics from time to time. This is not that we've had them that way. And they probably, my guess is they'll speed up. There'll be more of them because the incursion is greater. And so we really need a system here
Yes, yes, yes,
that
yeah,
deals internationally.
yeah.
So my last question to you, Carlos, is you're you're a traveler. You study international things. You study international cultures and political systems and social systems and economics. How likely is it that we're going to have an international system to deal with this?
It's going to be uneven. It's going to be ad hoc. So yeah, there will be, and it's happening already. Maybe Southeast Asia would be an example. The ASEAN, the Association of Southeast Asia, over the years now, multilateral dialogue. Somebody they've been able to actually respond in a very effective, cooperative way. So on one hand, at the international level, it's going to be hard to have a single World Health Organization doing everything. Instead, we'll see more of a regional response. But there are always going to be some places left out, some places simply that are not, able, and this is where again I would say ultimately it's the responsibility morally and just because of the vested interest we have, the wealthier countries have to help out those that don't have the way, the means, the resources, and it's going to be a challenge. So it'll be uneven, but the other last point I would say is that pandemics, we've always known they're there and that we've had them in the past. We've contained, in the past 10, 15 years, some others, the Ebola, the SARS. The bottom line is we've known them and they're going to be here in the future. There will be other ones. So yes, it is in our interest to figure out some better means of cooperation, collaboration, coordination, all of that. And as we see already happening in many places, these pandemics, they can help boost some political leaders, give them, some good, shine, let them be leaders, they can also bring them down and become political hot potatoes.
Yeah.
And that's happened already in a number of places too, where people are fed up and angry. In the last few weeks, we have a dramatic protest violence in Colombia, a country that has a history of violence, but they recently settled a long time guerrilla movement, the FARC. But now it started with a opposition to a tax reform bill to help pay for the pandemic crisis. But now it's morphed into anger about corruption, the government, the failure of the policies, and this is going to flare up in a lot of places. People have a lot of pent up anger and frustration, and the pandemic can just be the trigger that allows this to happen. So we're in for, I think, for a continued ride of these things. There will be future pandemics. There will also be social movements and pressure. People holding their leaders accountable when they don't deliver, because again, pandemics bring out the best and they bring out the worst in our leaders.
Yeah. Well, and to the extent that different countries have different experience, that disparity is ultimately converted into deaths. Deaths. A lot of people, millions of people dying. We don't see that on the charts and graphs they send us that we see on social media. But the fact is, there are millions of people dying. Big problem. The other thing I just want to add is this: that you and I, and our societies, Carlos, we don't really know the extent to which COVID has changed our country and our lives. We'll find out, just the way we're finding out things that Trump did, that we didn't know while he was in office. And little by little, we find out. And it's hard to look back on COVID in the past year, assuming that was a unit of time we're studying. But the fact is, a lot of things changed permanently in our society. Well, just to have that broader horizon, a lot of things are changing in the world.
Yes.
God knows how this affects not only the social and economic experience of all these countries, but also the political experience. I think, it's accelerating change
Yes.
right now, and we have to watch that.
Yeah.
Thank you, Carlos. Carlos Juarez, and this is Global Connections. We've been talking about the pandemic continues internationally everywhere. Thank you so much, Carlos.
Aloha. Thank you, Jay. Always a pleasure.
Always a pleasure. Aloha.